Yes.
Well, it is the beginning of another Saturday podcast. Woo!
Hi.
Yeah, welcome to Just Massage Therapist podcast, where we are just massage therapists. These are just our opinions, and we've got a lot of things that we have opinions on, and we're going to talk about them.
Yeah, we are.
But Cora, before we started, you had just started saying that you had an interesting client, an interesting case. What's going on?
Well, this client had migraines he's been having and migraines are off and on. He had a very significant trauma. And it was basically essentially he flew 40 feet. He ended up getting his spine fused from T10 to sacrum. He had seen me before for massage, and it was like, yeah, this is great. We're doing okay. And then I was like, we need craniosacral. And so he booked in for craniosacral, and after his treatment, his migraine was gone.
Nice.
And he was just floored. He's like, how did you do that? He's like, how?
There's a lot to explain, and I don't know if we're going to do that right now.
Well, I basically told him, I was like, I just initiated. You did it all.
Isn't that just lovely?
And he's like, for real? I'm like, yeah. So he's hooked. And I am just so grateful to be part of his healing journey. Like,
Yay.
I know there's like a difference between being thankful and gratitude, right? I can say thank you, and that's showing thankfulness, but like gratitude, I feel like they're different, like gratitude it's just like
it's deeper. It's got depth to it.
It's like your inner essence is just so grateful.
Oh yeah.
And it's not just saying thank you for doing this thing. And I'm just so grateful to be part of his healing journey. And it's just something that, I don't know, it's been a long time since I've had that kind of like gratefulness associated to a client, like to work. And that, like, I've always been like excited. It's like, oh, that was a great treatment. We did so good. But like that gratefulness, that overflowing, like I just haven't.
That's really cool.
It's like I just feel like, I don't know, I just feel so full.
Aww.
I guess. And it really, really made me realize that I get to go and do my MOT. I'm gonna go be an osteopath. It's something that is just, I'm going to do it.
That is really cool.
Yeah.
I'm so excited for you. I'm excited that you're taking these new steps. It's neat. It's super neat, and I love it for you.
And I was like looking into like the moons, right? Because the moons this year, I don't know why, but my husband, he thought it was really funny. This was the beaver moon.
Yes, the golden beaver moon.
He just thinks that's so funny. He just loves that. He's like, it's right in the middle of Movember. We have the beaver moon. And I'm like, yeah. And so I actually started, I don't know what kind of made me think, but I started looking into the moons. And the beaver moon is actually kind of like a purge moon. And it was, when I was looking into it, it's like, pay attention to what you're wanting to purge. And this whole 2-3 months, I've just been looking at my house, but I hate this place. Like, and I just because of all the chaos, and it's been building, and then I realized, like, I gotta just take a step. So the first step I took was my kitchen. And I know, right? And when I was looking into like, and in the article or the write-up, I don't want to call them articles because they're just the write-ups, but in the write-up that I saw about the beaver moon specifically was to look at where you're trying to purge. And if you're trying to purge your kitchen, it's like you're trying to release old nutritional habits and bring in new ones. And if you're trying to purge your living room and family spaces, you're wanting to purge old habits and bring in fresh your relationships. And those are the areas that I'm like, this is where I need to be. But I actually cleaned my stove today.
Oh my goodness.
I know. And I emptied out the pantry or my cupboards, and I threw out all my containerless lids.
That's really smart. Get rid of them lids, man. You don't need them.
And it's just like, where does this come from? Like, I woke up today, I'm like, this is what I'm doing.
We're making
pancakes, and this is what I'm doing.
You go.
What I did, and yeah,
I love that for you.
It's just, and then after, like, I was just like, I'm just gonna let go and go look for these signs, because like I've been having a lot of like spiritual conversations with different people from different religious backgrounds, and like so many different religious backgrounds, and it always comes down, and it's been kind of a consistent thing for the last year, actually. This 26 or 26.
We're not yet there.
Since September, I guess, since I started at LifeMark, since I had that new shift happening in my life.
Good shift.
I've been kind of just, but yeah, it's been there. And I was just like, I have to start listening to these signs, start looking for the signs.
Cool.
And the more I'm releasing, the more is coming to me. And like Jake, my boy, he's been wanting axolotl for at least just over a year.
Oh, he's been wanting one for a while. Yeah.
A while. Yeah.
It's been over a year because it was before I left.
Yeah. So it's been a long time since he wanted, and so we got this tank thinking he was big enough, to find out that ideally they need a 50-gallon.
How big a tank did you have?
Well, I had a 15. They're just little like this, right? But they get bigger.
Need space. Yeah, they need space to grow.
So they're like, yeah, it'll be okay for like the first 4 months of his life. It's like, okay, well, that's not realistic. We're not doing that to the poor axolotl. But a friend of mine is just like, just out of the blue today, he's like, yeah, do you know anybody who wants a 75-gallon fish tank?
Yes.
And I was like, yeah, well, my boy does. And he's like, okay. He's like, for you, it's free. Just like, what? He's giving me a 75-gallon fish tank. He's like, if it's going to bring joy, then yes.
It will definitely bring joy.
So now that gives my boy a reason to actually, because I was trying to use a Christmas tree. I was like, it's November 11th on Tuesday. Let's move forward. Like, help me find a place for the tree. Let's work together on this. Trying to like find a way to get them to help me without whining. I love my kid. I love them, but they're like, they take after me. They don't clean up because I don't. Monkey see, monkey do. If I don't, like, it's a thing. It's learned. It's learned. So, but now with this potential axolotl, there's a fire under all of our back ends, and we're gonna be getting her done tomorrow.
Nice. That's so cute. I love that for you guys. I do so much.
Yeah, it's like good things, all good things.
You can tell that Cora and I haven't talked all week.
And I didn't come early.
Yeah, it's just, this is what we do before podcast actually starts. Is we chat a little bit before, and then we jump in and everything, and then we chat a bunch after. But usually we've talked a lot throughout the week. But this week, she's been busy. I've been busy. It's been crazy. So don't mind us getting back in touch with each other a little bit before we start. Oh, that's really cool.
My Facebook just connected.
I was just about to do that. That is hilarious. Good timing.
Look at that. Thank you, Facebook.
So, as per always, if you're joining us on YouTube or Twitch, we can generally see your comments in the chat. If you are joining us from Instagram, then I'll be going back and forth looking, and if I miss your comment, I will get to it. I promise. Just stick around and we will get there. Oh, so much fun. Okay. So other than, life updates and things like that, what are we talking about today?
Active release.
I actually forgot. I was driving home today and I was like, what are we talking about today? Like, it just completely left my mind this morning, as I've been thinking about it all week. And then this morning, it's gone. It was gone out of my brain.
That happened to me last week.
Oh, yeah.
I was like, what are we doing today?
Yeah. Oh, yeah. And I have confirmed, by the way, for next week, that Elena is going to be joining us for the spleen.
Winnie.
Yeah. So if you do need to actually take the 15th and not, we've got Elena as well. So I know you were worried about getting home in time or being around in time on the 15th. So.
Yeah, well, the snow kind of flew, and my tires, I need struts. My tire's doing a weird, it's very persistent today, the clunking. So I don't know. Yeah, it's pretty. I could like feel the vibrations underneath my like while I was driving, my feet could feel the vibrations. So we're gonna see what Monday's car appointment looks like.
Well, let's hope.
Might not be for good things.
But let's hope for good things. Okay, we're gonna hope for the good things.
It will be good. The van's good. The van is it's my vehicle. It's gonna last for more than a year. Yeah. And I'm not at a dead end job, so
no, you're not.
It's not to have out on me because it's gonna take me to work. I won't need signals. To work. It will. Yeah. Yep. I won't need signals from because I'm out listening to the whispers, so the Durango won't have to give me the iron glove slaps.
That's good. I'm very glad. So to segue us closer into our topic for today, we are at the place I work. We are opening up a whole new menu because I work at a spa, which means we've got multiple different people doing stuff. We've got nails, we've got facials, we've got massage, all that fun stuff. And we're opening up a new menu that's going to allow me to do some of my deep tissue stuff as add-ons into my more Swedish and therapeutic treatments. The biggest one being things that are more in the active release.
That's exciting.
Oh gosh, I'm so excited for this whole month. I'm just every person I have, I'm like, can I show you what an active release is like? Can I show you what NMT is like? Can I show you what proprioceptive neuromuscular facilitation looks like? Just so they get an idea of what it is, so that in December and going forward, they'll be more apt to actually go, yeah, let's add that in here. Let's do that because it actually works and it actually helps. I have a lady who comes to see me who is a NKT therapist, so she does neurokinetic techniques.
Oh, okay.
We basically just swap stories on her neurokinetics versus my neuromuscular.
That's cool.
It is. It's quite fun. It makes me happy. So, Cora, how do you describe active releases?
Well, I basically would like to a client or to just in general.
No, right now to everybody who's listening or listening later.
Well, essentially what I would explain active release as a technique where I'm providing the sustained pressure, you're doing the movement, and in doing so, you are working to align those fascial bands and take the fear of movement out.
That's actually a really fantastic way of describing it.
Well, that's really how I view it, because when there is an injury, we have those holding patterns, right? And we're so stuck in those holding patterns based on fear of re-injury, or just you're used to it. You don't even think about it anymore. So you subconsciously just don't do the thing.
Do the thing.
You don't, especially with a shoulder dislocation, for example, like you're not going to bring your arm back this way because chances are pretty good that's how it dislocated.
Mm-hmm.
So you're going to be very cautious, very aware of your position in space, even if you're not aware that you're aware.
Your body remembers the trauma and it does not want to go through that trauma again.
No, it really doesn't. And that's something that I find is a huge limiting factor in our growth and in our wellness journey, just in general. It's just a huge contributing factor is fear. Mm-hmm. So in that movement, you're kind of signaling to the nervous system, oh, this is actually safe. And then once it's safe, then you can rewire.
I love that.
That's really how I feel about active release.
That's a neat way to explain it. I love that. I love that way.
Right? So how do you explain it? Oh.
Well, as a positional, because in my vernacular, it's a positional release technique type, right? There are 50,000 positional release technique types, and my dog is decided that he wants to be right beside me
Yeah.
and moving everything around. It's probably going to fall again one of these days. Jeez.
He's cute. It's okay.
But yes, no, there's the passive ones, the active ones, the neuromuscular ones, the stretching, strengthening ones. Like there's just so many different positional releases that can occur. On the active side, I've always looked at it as a technique that allows the client to participate in their own health. And it generally, whenever I do active techniques with my clients, they're more likely to actually follow through with home care later.
Yeah, because you have that proprioception. The proprioceptors are stimulated.
Well, and they feel like they're actually part of the treatment and not just a passive receiver.
Mm-hmm.
Right? They're both giving and receiving to themselves. So a while back, and when I say a while back, I'm talking like 16 years ago, maybe 15 years ago, I took this course called Movement as an Antigen.
Okay.
And it's one of the reasons why passive and active releases and NMT and stuff, all of this stuff has become such a big part of how I treat. So for those of you who don't know what an antigen is, it is something that enters your body. Usually we're talking about like a bacteria or there he goes.
Loki.
Yep, bacteria or something that gets into your body that's not supposed to be there. It is antigenous, not of your genes, not of you. Right? And what our body does to an antigen is it sends out, well, antibodies that are anti the body that came in, the bad thing that came in. So it goes and it tries to get rid of that out of your body. And then this course that I took and how it shaped the direction of my future was basically like, okay, you almost have to treat movement, especially if you're in pain or you're going through injury or something, treat movement as if it is an antigen, and you have to activate the things inside of your body that are actually going to help you move, that are going to help you move without the pain.
Okay.
It was a really interesting, I wish I could explain the whole course to you, but obviously we don't have time for that. Right? But it was saying the movement and the pain or the discomfort or the fear or whatever it is that is coming because of that movement, because of what's up in your brain with that movement and the inflammation that can occur. You're doing the movement and your body will then respond to the movement. If you don't do the movement, your body has nothing to respond to. Your body has nothing to fix. Right? It may have residual inflammation in that area, but until you do something that causes that area, right, that joint, that muscle, that connective tissue, until you do something that causes that area to be disturbed, your body's basically just going to let it continue being as is, right? Just like if you sit in a chair 24/7, your hip flexors are going to go into a shortened position because you're not stretching them. Because that's just how the body then thinks is normal now. Like that's just how it is now. Right? And so movement as an antigen, if I get my clients either by passively moving them or in the case that we're talking about actively getting them to move, they become the antibody to the antigen of that movement. I'm just heightening the antigen.
Okay.
Crazy, right? Like it's a really different way of looking at things, and I love it.
I kind of feel like it kind of links into that fear element, though.
Oh, 100%.
Yeah.
It links into fear.
Like, so I feel like I feel like the viewpoints that we have are very like crossing.
Mm-hmm. Well, they're parallel and perpendicular.
Yeah. Yeah.
That's really funny. Oh, now the dog has gone to annoy the husband. This is funny.
At least your backdrop will be safe.
That is true. This thing won't fall over because, man, how many times on this podcast is that thing fallen over?
I think like just
Okay. Yeah, maybe twice.
Well, we were live anyways. What happens
when we're saying active releases, I'm going to show an example of an active release for people who might not know what we're talking about when we say active release, even though we've described what we think. So I'm going to do it on my masseter because it needs it. I was eating pizza today and my jaw hurt. Eating pizza. I'm such an idiot. Okay. So what you do is you end up finding the sorest spot, what I like to call the head of the snake. And you want to cut off the head of the snake. So what we do is we find, where is mine? Oh, there's mine. Oh, I don't like it. We find the spot. Sometimes that spot is a trigger point. Sometimes that spot is an adhesion. Sometimes it's the edge of scar tissue, and it's just easier for them to move than it is for you to move in a region. Right? It could be at the musculotendinous junction of a muscle that is super utterly shortened or really, really taut and weakened, because you can do this on any kind. So you find it, and then you get them to do movements that make the muscle either contract, well, both contract and then stretch. So in the master's case, I'm going to go open and close, but I'm also going to go lateral and back. Press. Oh, that feels really good, but also really painful. The best kind of pain. Then you flushed out. How long do you usually like to do it for? Any one of them?
Well, it just very much depends. Like, usually when I do them, like, sometimes I'll go for the tender spots. But well, actually, I do go for the tender spots, but I usually go for the tender spots along the periosteum. Like, I don't usually look at the belly. I'll look at the attachment sites themselves.
Oh yeah.
Because I guess that comes from my rapid training. Like I do have well 2 rapid classes under my belt, and that part of it really resonated with me because everything communicates through fascia, right? So the bone connects to, or the muscle attaches to that periosteum. So it just makes sense that that's where you're going to make, to me, in my brain, that makes sense where you're going to make the most effect. But I'll usually I'll get them to, I can't really say I do time frames. I get them to do about 3 to 6 rounds.
Oh, okay.
So, and then I just make sure that they are going at their pace. So however long it takes, they're setting their pace, they're going how they're able to. And then that way I don't feel like anything's being forced or over treated. And then sometimes too, the tissue will just be like, okay, I'm done. And you'll get that dismissal. Mm-hmm. And once I feel that dismissal, it's like, okay, that's where we're done for there. Maybe I'll come back to it because I don't think we're done, but we're done right now.
Yeah. Oh God, the tissue always tells you, man, tissue don't lie.
No, it really doesn't.
I know when we were in school, I was taught that it was like no less than 30 seconds and no more than 90 seconds.
Yeah.
Right. But I have actually found the same thing as that, is it's like, I'm going to go for as long as they want to, or as long as the tissue tells me, whichever one comes first.
Mm-hmm.
Right. So if they're like, oh, I just can't do this anymore, or they're feeling like, oh, that really released and they want to stop, I'll stop. That's usually not the case. It's usually I feel it go, ooh.
Yeah, the ooh block.
Yeah.
Yeah. Yeah. No, that's something that I always like, the time frames I find if I'm counting, like when I do PNF or peripheral neuromuscular facilitation, I'm counting.
Oh, yeah.
But when it comes to like active releases or even passive releases, tractions, I don't usually count. It's just when have they had enough? And once you learn how to feel that, then it usually ends up between that 30 and 90 seconds anyways.
You are correct. It usually does. Although I've had a few that have gone for quite a while.
Yeah.
I think 3 minutes.
Oh, see,
moving
I can't
really, really slowly
okay.
through it. Like it was a knee replacement surgery. And we were working at the AIIS, the attachment for quad, for RecFem. And she literally she could barely move the knee. So she had to do it really slowly and with support. And I think we sat there for 3 whole minutes.
And see, and that's what the body needs. That's what it needs. As long as it was that gentle pressure where you're not forcing anything.
Oh yeah, no, never.
But
yeah,
I think it's really funny that you call it the head of the snake, because I always kind of think of it as like the Godfather. Have you ever had an active release when you're coming in and you find that really big, like you find them, the big giant silly thing?
It's so hard to describe it because sometimes it feels like this and other times it feels like this, but it's always that.
And it like ripples when it releases that ripple.
Mm-hmm.
See, I kind of like, again, this is kind of from my rapid. They called it the Godfather, and I was like, oh yeah, that I like that, because sometimes when you get that big bad guy, everything else just kind of all on that fascial line.
That's why I call it the head of the snake, because if you kill the head of the snake, the whole thing goes.
Yeah.
Right. And that's actually how we learned trigger point stuff too, was find the head. You need to find the head, because if you don't find the head, you're still going to make them feel better, but you're not going to fully release it. You're just going to release a tiny little area.
Because they're developing along that restriction.
Mm-hmm. You got to find the head of the snake.
Yeah.
It also makes me think of a movie that I used to love. Or not used to love. I still love it. What am I talking about? The Hobbit.
The Hobbit.
The last one, Battle of Five Armies.
Oh, okay.
Yeah. Where is he going? To cut off the head of the snake.
I can say I've watched The Hobbit more than once.
Oh God, I've watched it so many times.
So I kind of got annoyed when they made it a love story.
There was a love story part of it, but that was not a love story. There was just a small part of it that had the love story.
That changed. That didn't even need to be
of course. It didn't
Hollywood did it. And the fact, I don't know. Anyways.
Anywho, we're not talking about The Hobbit right now. Oh my gosh. Have you found that it's worked really well, not just in restriction in connective tissue, but specifically in the scar tissue that's restricted in connective tissue? Have you been? Yeah. Okay. Cool.
Yeah.
I love that.
If I'm with the scar tissue, I'm more like inclined to like passive movements though when I'm doing scar tissue. And then like that's just kind of, I just automatically go to those passive movements, find the areas that I guess I feel the most tension. And then that's usually when I'll like traction it. Actually, I find like tractioning the scar tissue works really well.
Yeah, tractioning, cupping. Cupping is so good with scar tissue. Oh my
it really is.
Movement cupping. I don't like the static cupping on scar tissue. I feel like it doesn't do enough.
See, I don't really like static cupping in general.
Point taken.
We're on
the same page there. Where is your favorite place on the entire body to do an active release? Not a passive, an active.
The neck.
Where? What muscle? What
levator.
Ooh, origin or insertion?
Insertion.
You know that place where there's a lot of scar tissue most of the time in most people?
Yeah, I love it. And I also really enjoy actually no, just jokes, the psoas.
Oh yeah, I should have known it was going to be the psoas. I should have saw that coming a mile away.
Levator's my favorite on day-to-day treatments. Like every treatment, it's like, oh yeah, we're gonna.
Oh my God, every freaking treatment, right?
Yeah. But when it actually comes to the psoas, that's actually the only way to treat it. I'll come in, I'll do the fascial, I'll do my fascial spreading, and then I'll straight up. They're going to be bicycling. They're going to be internally, externally rotating. It's like it kind of initially started for me to always know that I was on the muscle, and it was that yes, here it is. I feel it moving. I am not on the appendix. I am not in the organs. Like
Or on the
I didn't
aorta.
slide off of it.
Descending
I'm
aorta.
exactly where I'm supposed to be. I know this. I feel it. And then I just found that it just works amazing because again, they're in control. They're in full control.
Yep.
So not one. I've had people tell me how they're scared of psoas release because they are like they've been down for days after, and I'm like that shouldn't be.
That should never happen.
That shouldn't be. But they're down for days, and I was like, I promise you that won't be here. You might be sore a little bit tomorrow, but make sure you drink your home care.
Drink your home
water.
care and do
Drink
your
your
water.
home care, folks.
Please
and then
do your home care. Oh my god.
Do your home care. And make sure you do the stretches. And it's with the psoas, I always get them initiated with a gravity stretch. So that, again, they're not stressing anything. They are in full control. The body's doing what they're meant to do, what it is ready to do. And then I'll graduate them to the PNF after they're done with the gravity. But they're in full control. And if there's a trigger point there, they'll slow down. And then the muscle is actually moving me. So the connective tissue is very much directing me. It's like, okay, we're starting here. We're here. We're not going further, or we don't need to be there. And it just keeps me going. And I just find that that's a great,
That's so cool.
Yeah, I love it. Like yeah.
You know, I don't know what my favorite one as of lately, because I've had to do so many of them, but also it's been so much fun to find new ways to do it, is piriformis.
Ooh, yeah, the piriformis is a good one.
I had a client, we couldn't, same client actually with the knee. 2 clients actually that same week couldn't, this treatment couldn't go on their stomach.
Okay.
And didn't want to go onto their side. So we basically did the whole treatment supine, but needed some piriformis release. So I actually ended up and under.
Oh, yeah.
Or
did you cup it?
Awesome. No, I went knuckles.
Okay.
I think at my second one, I did the cup and used the fingers, but like I knuckled underneath. Oh, the second one I also had stones, which was so cool to get a stone up in there and do some active stuff in there. But no, for her, because she can't handle a lot of pinpoint pressure. So to have all the knuckles and then be able to adjust them to make sure that they're not too hard, right? It could either go harder or lay them a little bit flatter. And then she did the movement and the motion. Oh, that was fantastic. So yeah, I've started now in my repertoire of things going, oh, if there's a piriformis issue, I might do it from supine more often.
I really do enjoy that. Like I usually hug the trochanter when I do it though, and then I get that internal external rotation still. So very similar to the psoas, but like I'll just hug that trochanter.
Yeah. Yeah, that's fun. Oh, it's been so much fun. I had one just the other week who it was quad fem.
Okay.
Yeah, I was like, whoa, this is cool. She had on one side it was superior gemellus. Could tell that it wasn't piriformis.
Oh.
It was so bad. I was like, this is way too small and does not go back far enough. I'm like, this is superior gemellus? Seriously? Either that or obturator internus. It's going to be one or the other because they're right there.
Mm-hmm.
Right? And then on the other side, it was piriformis. But on the one side, it was like, this isn't piriformis. Like, it's tiny. This is a tiny little dude. It was pretty intense. And then quad fem on the other side, too. Piriformis and quad fem on the both sides.
That tracks.
Oh, my God. It was so funny.
So did you have sciatic issues, too?
No, not yet.
No.
It's one of the things that we are trying to not have happen. Right? Some low back pain, some hip dysfunction. And I was like, okay, well, we're going to obviously get into all of these things. But yeah, all of them I use, I've been able to start actually using, because none of them were deep treatments. But as I'm trying to get people to be like, okay, this is an add-on that is coming. Let me do it for free right now so that you get an opportunity to feel what it is like. And now all month I get to do it. All month I get to do it.
That's a win.
I know. I'm so excited. Active releases, guys. They're just something else. They
really
something
are.
else.
Well, I just think it's how it's really interesting just how the body responds to it too. Like there's something to be said to making the muscle do the work.
Yeah.
Like, it's almost like, having to clean up your own mess.
Yeah. It's a freaking antigen, man.
It is. Yeah. Like it's just interesting. It's just, I love that. I love the idea of that because it really does reset that nervous system.
Mm-hmm.
It really does.
And you can do it on a shortened, hypertonic, messed up, even a muscle that's in an intrinsic muscle spasm, not like the big muscle spasms, because that would be way too painful. But you can do it on those ones, but you can also do it on the long, stretched, weak, taut muscles, the ones that you don't want to do stripping through.
Well, yeah.
You can do it on those because you're not going to cause that muscle to get even more lengthened. You're going to release an area, and then you're also moving it. So that muscle is active. It's actively shortening.
And then it's also triggering those proprioceptors. It's like, oh, yeah, I remember this. This is how I'm supposed to move.
Yeah, this is how it's supposed to work.
Yeah. Mm-hmm. And that's where I think also it's really important with the active release that they know how to move. So like actually taking them and showing them, this is what I want you to do. Like if you're working with the peroneals, I want you to come show them what eversion looks like, show them what inversion looks like. And this is the action I want you to do.
Yeah.
Show them that plantar flexion and eversion, like show them physically so the proprioceptors can fire.
Take them through that motion so that they're able to follow along.
Yeah. And then watch it, make sure they're doing it right because they're going to be tricksy.
Oh, yeah. Every time I do quadratus lumborum, I'm just like, okay, so you know how you shrug your shoulders, right? We're going to do the same thing for the hip on one side, but you're not going to push it backwards or forwards. It's just going up towards your ribs. Every time they push it backwards.
Well, that's a really hard holding pattern to lose. Like that's so many people are rotated. And with that rotation, there's that compensation. And so retraining that compensation, especially with a QL, like even when you're assessing its length and its strength, like it's so like, no, Beyonce hips, like hips don't lie.
Shakira hips.
Shakira
and Beyonce, both of them, honestly.
Shakira's better though. Shakira's better with her hip movements. But I always think, I don't know why I always say Beyonce hips, but
both of them work.
Yeah,
honestly,
it's just. But Shakira's hips don't lie.
Yep.
Oh, yeah, she is. But that's always like you guys straight up and down. But it's a thing, especially with that low back pain, and then that fear of it too, right? Because that elevation, that's probably where the injury occurred, with that pure elevation, maybe with a rotation, but there's that element.
There is that element that goes with it, for sure.
Yeah.
And for anybody who is interested, when we do start in the new year, as we come up to the new year, we start offering our specialty treatment specialist courses. That is, we're doing active releases inside of them as well. So we're not doing an active release course. We're doing active releases that are specific to conditions. But of course, you'll be able to use those in other conditions for those motions as well. So yeah, we got that all coming up. I'm so excited. 2026, we start adding more courses, more in-person courses to the roster.
It's coming.
I'm so excited. Okay. Oh, it was good. That was a fun chat. I love that. I love active release stuff.
Me too.
I have ideas for December podcasts that we're gonna chat about after we hang up on you guys, after we stop going live. Behind the scenes. Oh my gosh, we're such dorks.
That's okay. It's a good day.
Oh yeah, today has been an excellent day. Okay, fantastic. Well, as per the usual, you guys are always welcome to come and follow us on our social medias. These are for Instagram, CNC Learning Hub. You'll find it on Instagram and Facebook. Cora Peters RMT is Instagram. Is it also Facebook?
Yeah.
Yeah. And then Just Massage Therapist, which is me, is just Instagram. I'm not a Facebooker. Oh yeah, welcome to come and see us. And if you are looking for us on YouTube, it is CNC Talk Healthcare, where Cora and I talk healthcare, literally CNC. All right, cool. Well, let's you and I go and have our chat, and we will see you guys in a week with Elena talking about the spleen.
It's exciting. We're going to have a spleen today.